You're pulling on your socks this morning and something feels just a little different, maybe a bit numb, maybe a strange tingling you can't quite explain. You brush it off. Just aging, right? But here's the question worth sitting with. Why do your feet sometimes reveal diabetes-related problems before you even realize anything is wrong? Nerve and circulation changes can develop so gradually that they're genuinely easy to dismiss. What if that tiny change you noticed while putting on your socks was actually your body handing you an early warning? And here's the twist. The most important warning sign often isn't pain at all. Today, you'll learn exactly what to look for, what it may mean, and when it truly deserves medical attention. Let me tell you about a woman in her late 60s who kept noticing tingling in her feet. She blamed her shoes, then poor circulation, then simply getting older. Months passed before she mentioned it to anyone. Here's why that assumption can be genuinely dangerous. Some diabetes-related foot problems develop quietly, without pain, without drama, just slowly accumulating in the background. This is what doctors call peripheral neuropathy, nerve damage that, in simple terms, disrupts how signals travel between your feet and your brain. But how exactly can a problem involving blood sugar end up changing the way your feet actually feel? Warning sign number 1 is any sensation that simply shouldn't be there. Numbness, tingling, burning, or that classic pins and needles feeling. Here's the mechanism. Chronically elevated glucose can gradually damage the peripheral nerves that run through your feet, disrupting normal sensation over months and years of exposure. Let's do a quick self-check right now. Does one foot feel noticeably different from the other? Do your toes feel numb even slightly when you press on them? Do your feet burn at night, especially once you're in bed and everything's quiet? Do you sometimes feel like you're walking on cotton, like the ground isn't quite solid beneath you? I want to be clear. Neuropathy doesn't automatically mean someone has diabetes. There are other causes too. But unexplained, persistent symptoms like these genuinely deserve proper medical evaluation. And there's another sign that can be even more dangerous because you may not feel it at all. If any of that sounded familiar, drop a comment with your age and country, and hit subscribe if you're finding this useful. Warning sign number 2 is arguably more dangerous because it's the absence of something rather than the presence of pain, a genuine loss of protective sensation. Picture this: a small blister forms, or a cut, or your foot rests against a pressure spot or hot surface for too long. Normally, pain would alert you almost instantly, pulling your attention right to the problem. But with reduced sensation, that alarm system simply doesn't fire the way it should, which means injuries can go completely unnoticed for days, sometimes even weeks, quietly worsening the whole time. This is exactly why visually inspecting your feet every single day matters so much, checking the soles between your toes and around your heels carefully, because your eyes may need to do the job your nerves no longer reliably can. But sensation isn't the only thing diabetes can affect. Your feet also depend on something else entirely to stay genuinely healthy. Warning sign number 3 involves changes in color, temperature, or healing, things genuinely worth paying attention to. Unusual redness, a pale or bluish appearance, one foot feeling noticeably colder than the other, swelling that wasn't there before, or wounds that seem to heal far more slowly than expected. All of these can point to circulation changes, since healthy blood flow depends on vessels that function properly, and diabetes can affect that circulation gradually over time. I want to be careful here. Noticing one of these changes doesn't automatically mean you have diabetes. There are other possible explanations too. But when circulation problems and diabetes combine together, that pairing genuinely becomes more dangerous, since reduced blood flow can slow healing even further, right when your body needs it most. Now comes the warning sign many people discover only after they take off their socks. Warning sign number 4 is right there on your skin and toenails, quietly telling a story if you know how to read it. Dry, cracked skin around the heels and toes is common, but persistent cracking deserves attention, since those tiny fissures create real opportunities for bacteria to enter and cause trouble down the line. Fungal infections and changes in nail texture, thickness, or color can happen for many reasons unrelated to diabetes, but when they're persistent or keep recurring despite treatment, that pattern is genuinely worth mentioning to your doctor. Here's a simple mental checklist to run through while looking at your feet. Is the skin unusually dry or flaky? Are there any visible cracks, especially around the heels? Do your toenails look thickened, discolored, or oddly textured compared to before? Is there any unusual odor that wasn't there previously? None of these alone is an emergency, but together they paint a picture worth paying attention to. But what happens when a tiny problem like this actually becomes an infection? Has anyone ever pointed out a change in your feet you hadn't noticed yourself? Let me know in the comments. Here's where things can escalate quickly. A tiny cut, barely noticeable, seems totally insignificant at first. But in diabetes, three things can combine in a genuinely dangerous way. Reduced sensation means you don't feel it. Impaired healing means your body repairs it more slowly than it should. And elevated infection risk means bacteria have a real opportunity to take hold and spread. Watch for increasing redness spreading outward from the wound, warmth around the area, swelling, any drainage, worsening pain, or fever, and feeling generally unwell. Here's the distinction that matters. There's a real difference between reasonably watching a wound for a day or two and needing to seek medical care right away because something looks off. And here's the critical message. If your sensation is reduced, don't wait for severe pain as your signal, because that pain might genuinely never come the way it would for someone else. So how exactly can you check your feet at home without any special medical equipment at all? Alright, let's turn this from fear into something empowering. A simple 60-second foot check you can genuinely build into your daily routine, right alongside brushing your teeth. Look at the tops and bottoms of both feet, taking a real unhurried look, not a quick glance in passing. Check carefully between each toe, where moisture and pressure spots often hide unnoticed. Scan for cuts, blisters, cracks, redness, swelling, or any unusual color you haven't seen before. Give your shoes a quick check too. Sometimes a small object or rough seam is the actual culprit behind irritation you've been blaming on something else. Pay attention to whether your sensation feels different from before, even subtly. If seeing the soles of your feet is difficult, a simple handheld mirror on the floor works perfectly well. And there's no shame in asking a family member or partner for help with this. An extra set of eyes genuinely catches things you might miss on your own. 60 seconds done consistently can make a real difference. Subscribe, give it a like, share it with someone who could use this, and drop a comment below. I'd love to hear from you. Now here's something important. Identifying neuropathy isn't simply about guessing based on symptoms alone, even the ones we just covered together. Clinicians use proper tools to assess sensation, check pulses and circulation, examine skin condition, and evaluate other risk factors together as a complete picture, not just a checklist. A professional foot exam can genuinely catch problems before complications become obvious to you at home. So let's be clear, your daily home inspection is genuinely useful, and I hope you keep doing it. But it doesn't replace an actual medical evaluation. Think of it as your early warning system, not your diagnosis. Here's the deeper meaning behind everything we've covered. Your feet aren't the disease. They're often simply where a problem first becomes noticeable, but the underlying issue could involve glucose control, nerve function, circulation, or several factors working together at once. So please don't focus exclusively on your feet and ignore the bigger picture. And I want to be genuinely fair here. Unexplained neuropathy has plenty of causes beyond diabetes, including vitamin deficiencies, certain medications, alcohol use, and other conditions entirely. This isn't meant to leave you convinced you have diabetes based on a video. It's meant to help you notice patterns worth discussing with your doctor. Let's be very clear about what's routine and what's urgent. Something to keep an eye on and discuss at your next appointment is different from something requiring prompt medical attention right now, today. Seek care immediately for a wound that looks infected, rapidly increasing redness or swelling, any blackened tissue, significant color or temperature changes, drainage or fever with feeling seriously unwell. I want you to understand why this section matters so much. The goal here was never to scare you. It's to help a small, manageable problem stay small instead of quietly becoming something that changes your life. Has this changed how you'll be checking your feet? Let me know in the comments. I'd genuinely like to hear. Let's go back to where we started. That small change while pulling on your socks. Here's the real lesson. The most important warning sign is often not dramatic pain at all. It's the subtle stuff, a change in sensation, a shift in skin, circulation, or how quickly something heals. Get familiar with what your feet normally look and feel like, so you actually notice when something shifts, even slightly. This isn't meant to frighten you. Paying attention early simply gives you more options and more time than waiting ever will. And if you have diabetes, there's another part of your body that can quietly show damage before you notice major symptoms. That's what we're covering next, so don't miss it. Subscribe and drop a comment with your age and country below.